Does your child suffer with something you just can't put your finger on? Maybe it's an attention disorder, maybe it's a sleep disorder, or headaches, or maybe even a developmental issue. Well, today I am at the DENT Pediatric Neurology Center, where I am going to bring you some information that you absolutely want to make sure you have your pens and papers for, because this information is going to be life-changing. Hi everyone, I am Anna Marie Sinatra from Sinatra Solutions and host of Health Matters. So get those pens and papers ready, because I've got the information for you today.
DENT Neurologic Institute is proud to support Health Matters. DENT Neurologic Institute offers neurologic education, state-of-the-art diagnostics, and cutting-edge clinical research. If you or someone you know is looking for more information, visit our website at dentinstitute.com.
I'm Dr. John Ziliaks. I'm a chiropractor and New York State board-certified nutritionist and dietitian who's happy to sponsor Health Matters. Together, we are informing the people of Western New York on how to improve their life both physically, nutritionally, and emotionally. Don't spend the last years of your life in a disability zone. Wellness is your best health insurance.
Hi, I'm Kim.
I'm Mitch from Pure Life Energy Saunas.
And together we are proud sponsors of Health Matters, a program that educates the community on how to be healthy, mind, body, and spirit. So follow us, because your health matters.
I am so excited and honored to be sitting next to Dr. Qasaymeh, who is the Pediatric Neurology Center Director here at DENT. And instead of seeing a wall of fame with all of his awards and accomplishments and his degrees, we're looking at this beautiful picture that I am telling you, when I look at it, I just feel so tranquil and peaceful that I can barely get my words out. This is just so exciting. Dr. Qasaymeh has been named top doctor for 3 years in a row at the Castle Connolly's Top Doctor list, which is published in the Buffalo Spree. He has been awarded Patient's Choice Award and the Compassionate Doctor Recognition. And I'm reading them all off this paper because when I came in and saw, I'm looking for the Wall of Fame, I saw this. And just immediately, as well as talking with the doctor, felt so peaceful and calm. So this has to be wonderful for when people come in with their children to see you.
And really thank you very much for the introduction. I totally agree with you. I mean, when a person is visiting a doctor, it's not the easiest situation, as you can imagine. When it's a child, it's even more difficult. My philosophy is to make the best out of any situation. Having a picture like this, I mean, is just meant to get or to add a relaxing touch to the office setting. I mean, putting certificates and awards and recognition is an option, but I just felt that it's more relaxing to have a picture like this.
You know, doctor, it really works, because when I look, even just looking at it, it's such a beautifully well done photograph, and it really does, it draws you in, and there's something about it that just feels so peaceful. And I would think that when people come in with children, even so, rather than looking at a wall with all the degrees and all your awards, they're feeling peaceful and calm. You've achieved what you set out to do.
Thank you very much. Thank you.
So tell us a little bit about your background before you came to DENT and all that you've experienced.
I actually have a degree in general pediatrics that I graduated back in 2004 with a degree in pediatrics, which is my passion all along. I always wanted to do something in the medical field that has to deal with the younger population. I feel it's challenging. I feel it's interesting. I feel that it's mentally stimulating. You know, if you have a person who is telling you what's his or her problem in their own words, you know, you can always take it from there and try to narrow down what's happening.
Right, right.
When you have a child,
They can't communicate.
a 4 weeks old,
Oh,
a 2-year-old, I find it very challenging to know what's happening. Now, that's what drew me in pediatrics, and after I finished my training in pediatrics, I was thinking about a subspecialty, and I could not find anything more challenging than neurology. As you imagine, the central nervous system is very complicated. You're talking about the brain, the spinal cord, the nerves, the senses, vision, hearing, and I did 3 years of training at the University of Rochester. And actually, after I finished my training over there, I got hired at the University of Rochester as an associate professor, as an assistant professor, I should say. And I worked there for a little over a year, but I was really interested in developing my own center, my own practice. And I joined the DENT Institute back in 2009, and I have been there ever since.
wow. And we're so lucky to have you here too, because as you said, what's so important, what we want to make sure that you, the viewers, are hearing, how important it is, how specific it is for children, whether they're newborns right up until adolescence to 18 years old, to have a doctor who specializes in those kinds of issues. Because as you said, as an adult, we can come in and we can talk to the doctor and tell them what we're experiencing, but small babies, I can't even imagine.
It can be challenging sometimes. Now, pediatric neurology is actually a specialty that's not well served. If you ask me, what does that mean? By the year I graduated, maybe now it's a little different. We had around 1,000 pediatric neurologists in the whole country.
Wow.
Now, you can imagine how limited of a number is that. Now, give and take a few hundreds now, I mean, I think we have more than that, but we definitely don't have 50,000 pediatric neurologists in the United States.
Wow.
So it's a very limited specialty, and with all the medical students that I have who come and shadow me, I always try to recruit as much as I can. You know, I feel that's something, the way I look at it is I got to show them the beauty of this specialty. I got to show them the challenge of this specialty. And I have been successful in a few cases, actually.
Keep them here in Buffalo too, right? In Western New York.
That,
they get their education and then they go away.
Right. That's another challenge.
Yes, it is. Yes, it is. You know, and so let's talk a little bit too about all the different things. I was reading the epilepsy, muscular dystrophy, multiple sclerosis, Rett syndrome, which I'm not familiar with at all, attention disorders, cerebral palsy, brain tumors, developmental delay. That's interesting because there's so much of that as well. With, I'll finish the list, the sleep disorders and headaches. But I can imagine it just seems as if we're on the rise of our children. And I don't know, I'm just saying from a viewer just like you, that we're on a rise of children coming in with a variety of different problems.
Well, I mean, those illnesses have been there all along. It's the science advancing and more specialists joining the group redefined and reclassified those illnesses. This is why it looks like a long list. Now, if you talk about headaches alone, we can group under headaches multiple other syndromes like migraine headaches, tension headaches, cluster headaches, post-traumatic headaches. The same thing with seizures and epilepsy. This is just a one headline, but under epilepsy you have absent seizures, focal seizures, generalized tonic-clonic seizures, myoclonic seizures, infantile spasms. So we're talking about a specialty that, as I said earlier, you need to spend about 14 years getting that degree.
Wow.
So you do 8 years of medical school, then you have to do some sort of training in pediatrics without the neurology part, which can range from 2 to 3 years.
Wow.
And add to that another 3 years in neurology and the pediatric neurology field. That will be a 14 years.
Wow.
So you're right. I mean, it sounds like those numbers that you're listing as a long list, but it can even get longer from here. I mean, it's a very...
From the different, these are just the main titles.
Those are the
but
main
there's lots
titles,
of stuff
right?
underneath them as well.
You're totally right. Now, I gotta tell you
Wow.
something about my work. I mean, we like to help people. We like to see patients. But during the days where we're not seeing patients, I'm happy. I know that my patients are in good shape. They don't need me. And there are not too many people sick out there.
Oh, that's beautiful. And I understand too, when I did my homework, that when people call you, what is different, you know, sometimes we need a specialist and we call and we have to wait like weeks to get in, that you will most of the time see a patient within 24 hours?
Well, that's a very good point. I mean, one of the things that was frustrating me when I was doing my residency and fellowship is that many patients would show up in the emergency room.
Yes.
And I will be asking them, how long this been going on? Oh, doctor, it's been like 3-4 weeks.
Oh.
Well, you didn't seek an opinion of a neurologist? Oh, we did. How did you do that? Well, I called the office 7 times, but there is a wait. Well, I mean, my philosophy is if you need the patient, if the patient needs the physician, they need them today.
Yes, exactly.
They don't need them when they feel better. They don't need them when they're feeling great. They don't need them 2 months from the onset of the symptoms. If you need me, you need to see me when you need me.
Wow.
That's how I look at it.
Wow. That is so beautiful.
Thank you.
It's so beautiful. So tell me a little bit about the sleep disorder as well, because I know that there's other sleep disorder clinics in the area, but they're always for adults. And you
Right.
have them, they could be 5 years old, that we can do a sleep disorder overnight. Is that an overnight with children?
Well, I mean, a
5
sleep
years?
disorder is a description about sleep disturbances and illnesses that can lead to all sorts of problems in a child. There are clinics in Western New York that sees kids with sleep disorders beside our clinic, and there are specialists in that field. The thing about sleep disorders, they can present in different ways. For me or you, if we don't have a good night's sleep, I mean, oh, I'm tired, I'm having a headache, I'm not feeling well, I know I didn't sleep the night before. For a child, it can be different.
Mm-hmm.
You know, we see behavioral changes, we see mood changes because they're not having a good night's sleep. We see academic decline,
Wow.
we see headaches,
Wow.
we see symptoms that look like attention deficit hyperactivity disorder, where in real life, it's actually they're not getting a good night's sleep. Now, for examples, kids who have large tonsils clogging their throat, they're not getting enough oxygen at night, and they have an issue. And with those kind of patients, we tend to run a sleep study overnight, and that sleep study will show what's happening. Is it a sleep apnea? Is it that their oxygen is dropping or something like that? And we do run sleep studies as young as 5 years old for our patients.
Well, you know, doctor, when you're talking, all I could think about is not to upset my 2 sons to tell anything on them, but I had some problems with them when they were babies, and it would have with sleeping and all kinds of different things. And I've never got past the pediatrician. how I wish you were, I won't tell you how many years ago that was, how I wish you were around back then as well, because there's some things that showed up in their adult life that as you're talking, I'm thinking
Right.
about how lucky you are to be hearing this and watching this today, that there are some tests and some answers for you
Right.
because what it could lead to in their adult lives.
You're totally right, Anna Marie. The thing is, we are very lucky in Western New York, because I gotta tell you, the pediatric community in Western New York is very solid.
Wow.
I am really privileged to work with all the pediatricians in the community, and they do a very, very good job in sorting out who needs a sleep study, who needs an MRI of the brain, who needs to see a neurologist. And so I can relate to what you're saying, but I am sure my colleagues out in pediatrics do a very, very good job in sorting those things out.
And my children are my two sons are adults now, so this was quite
Right.
some time ago, and they probably didn't have the education and all what you know today. But I'm not kidding you, and I almost feel a little teary. I don't know if you see that, but yeah, both my kids went through a lot as infants and then young toddlers.
Right.
Again, so who knows what could have been different had this been available to them back then. So
Right.
that's why I just feel so encouraged for you who are watching today that you have DENT right here in Western New York.
Right.
And you, doctor. And tell me what, because that's what got to me too, the attention disorders, when you started talking about that. Because both my children, you know, they wanted to put on Ritalin when they were very little, just starting school. And I said, absolutely not. You know, I would not do a drug regimen with them. So I'm interested to know more, because I know that our viewers write in and talk about that as well.
Right. Well, that's correct. I mean, kids with attention and concentration issues, they can sometimes have sleep problems that manifest itself in the form of an attention deficit hyperactivity disorder.
Wow.
Now, I mean, let's be very clear about that, though. Not all kids with attention deficit
Right.
hyperactivity disorder are having sleep problems, but some of them can. And those are the ones that benefit the most from addressing
Wow.
their sleeping issues, which, as I said, can be sleep apnea, restless leg syndrome, periodic limb movement, narcolepsy, which is a fascinating diagnosis sometimes that we uncovered in a few of the sleep studies that we have done.
What are some of the common things that you do see? Like the most common thing for people who are watching now, and that you're probably popping with a million questions. You're going to have to visit DENT, the Pediatric Neurology Center. We have it up right on the website now as I'm looking at it, which let me just say here for a moment, if you haven't been on DENT's website, you absolutely need to get on it, because it is jam-packed filled with so much information, and each of the doctors' pictures so you can familiarize yourself, and I think even make appointments through it too. But so what are some of the things that you see that are real common?
This is an excellent question. And if we are to divide the percentage of the diseases and the pathology that I see in my office, I would say the following. 30% or 35% of my patients are patients who are having headaches and head injuries, meaning headaches, concussions are 1/3 of my practice. Another 1/3 is patients who are having seizures. This is a common problem in pediatrics. Absolutely.
Wow.
Now, third comes patients who are having abnormal movements, like something called a tic disorder.
Oh, really?
You know, this is a very common problem in the pediatric population, where they exhibit abnormal movements like excessive blinking, twitching of the head and neck area, throat clearing, sniffing, sniffling. Those what we call them tics. Another percentage is patients who have developmental delays, who have muscle diseases, who have multiple sclerosis, who have sleep problems, as we said, brain tumors. I mean, I'm saying that sadly because we see that often as well. The bulk can be summarized by the majority of patients we see headaches, head injuries, seizures, and epilepsy. abnormal movements. Those are the biggest group of patients that we see. Now, I know you seemed a little disappointed when I said epilepsy is a common problem in
Yes,
kids.
it's surprising.
Yeah, I mean, I can relate to that. I'm not the happiest person when I make that diagnosis, but luckily, epilepsy used to be a refractory disease that you used to have 1 or 2 medications available to treat the person.
Mm-hmm.
And I gotta tell you that those medications that we used to have, meaning phenobarb and dilantin or phenytoin, they're not the best medications. They were horrible. They were
Wow.
leading to all sorts of side effects and
Wow.
all sorts of problems. Luckily, nowadays we have, I would say, more than 10, 15 different seizure medications. Many of them are so safe that you don't need to monitor the blood level of the medicine or monitor the liver or the kidney function. And to me, that's very rewarding because, you know, when someone comes to you with a problem, you don't want to give them another problem by giving them a medicine that results in more side effects.
Yes.
Now, that's not all. I would say 2/3 of my patients with seizures, 2/3, that's a good percentage.
Yes, it is.
They actually recover from their seizure within a couple of years.
Really?
Totally recovered to the point that they don't need the medicine. Now, I'm a positive person, so I'm looking at the 2/3. Now, the sad reality is that there is a 1/3 who may require more than 2 years, and some of them, they require a lifelong treatment.
Wow. So
Right.
would that be a direct result from them taking the medication, or do they grow out of it, or is there also some treatment, some physical therapy that you're doing as well?
That's a very good question. The seizure medications are meant to hold your seizures from happening until your body gets over it and it kind of heals itself by itself.
Oh.
So if you're asking me, are those seizure medications like an antibiotic? You take the course and it gets rid of the disease? The answer is no. You know, I don't
Sounded
think.
good.
Yeah, it sounded good. I wish we have that.
Yes.
But unfortunately, that does not exist. But at this point, the seizure medicine is meant to hold those seizures from happening until your body outgrow them, which happens in quite a good percentage of my patients and the pediatric patients in general. This is what's rewarding about pediatrics.
Oh.
You know, they are healthy, they are young, and if you can hold them through that stage where they are sick, you make a big difference in their
Oh,
life.
that's so beautiful.
Right? And
so
that's the
beautiful.
most rewarding part of pediatric neurology.
Your face just lit up when you said that too.
Well, it makes me happy.
I know, I see that. Before we're winding down, and I wanted to be sure that we did mention that you do CT on newborns, that you even do newborns here.
Yeah, absolutely. Yeah. I mean, as a pediatric neurologist, you're specialized from day 1 to the age of 21, you know. So we can see as young as a day old, a week old, a month old. So there is no limit on the age. As a matter of fact, as a pediatric neurologist, you have to be specialized in neurology. So you kind of see all kind of age groups, but we call it pediatric neurology. We are certified as neurologists with special qualification in pediatric neurology. And that is actually the summary about our specialty.
Wow. Is there anything else that you want to say? We're down to our last couple of minutes,
Right.
and it's been so wonderful to be here and get all this information. And I know you're so positive, and it is because it's kind of sinking when you listen to all these different things that our children are going through. So
Right.
what can you say so that we can end this in a positive note with your enthusiasm and your excitement moving forward?
Well, one of the things that I would like to have the parents and the families at home know is actually a message directed toward concussions. You know, we are a sporty town. You know, we are the town of the Bills and the Sabres. And we all want our kids to be stars, and we want them to be very active out there, me included. I have a 5-year-old son, you know, I want him to be out there playing all kinds of sports. But the message I want to get out there, you know, concussions are becoming an epidemic. I have been seeing more concussions over the past 5 years, more than any other period of time. During my training, during my work in Rochester, I did not see that many. I think part of it is that we are aware that concussions are not good, but I think prevention is a key. I would suggest to the moms and the dads out there, when you're driving your child to a hockey game or when you're driving them to a football game, please remind them how important it is to think about protecting themselves before taking the team down or before winning the game. What they need to do, you put your feet on the field, think twice how you're going to protect yourself. Tell your child that, and that makes a difference actually, because I don't want the idea for the kids who go play football and hockey is that, okay, I'm going to go play this game, win at any expense. Health is the ultimate wealth, and we want to make sure that they are safe and having fun.
Wow, and keep them out of your office
Absolutely.
by doing that. What a perfect
I would
note.
be very happy with that.
What a perfect note to end on. Thank you so much, Doctor, for taking time out of your busy day, seeing all your babies and all your adolescents and toddlers and all of them to come and share this information with us.
It's my pleasure. Thank you.
Thank you. There you go. You got all the information. Children are different. And besides the obvious reasons why your child may need to see a pediatric neurologist, now we know all the other reasons why it might be vitally important too. You have the information. It will be powerful when you act on it. So keep those emails coming. Visit us on Facebook. Visit the website so that we want to hear from you. Stay in action because information is powerful. This is Anna Marie Sinatra from Sinatra Solutions and your host of Health Matters with your healthy tip. Next time you're getting ready for a doctor's appointment, get out your pen and paper and write down the questions that you want to ask him. Then when you go, write down the answers he gives you so you'll remember the good information that he's giving you, because remember, that information is power.
Hi, I'm Kimberly Will from Mr. Frank's, and I'm a proud sponsor of Health Matters, and I am very motivated and inspired by all of the information that the show offers.
Amherst Laser and Wellness is a proud sponsor of Health Matters. I'm Teresa Horab, registered nurse and owner of Amherst Laser and Wellness. We look forward to moving you in a healthier direction through our laser lipo and nutritional counseling. So follow us and continue to watch Health Matters on your journey to wellness.
We want to thank Marge Reed from the Healing Spa. Marge is an ordained Unity minister. She has her BA in complementary health, and she's joined by her beautiful daughter Gina, who's a registered nurse. Together they bring us the latest technology in stemology, skin care, stem cell therapy, and holistic modalities for your body, mind, and spirit. Join Marge on Sunday mornings for her 11 a.m. service.